So in the third section of our lecture topic, premalignant diseases, now we will talk about cervical intraepithelial neoplasia. Cervix is the lower part of the uterus and that opens into the vagina. Cervical neoplasia or cancers, they are common in females, especially in the reproductive age. It's cervical cancers are caused by HPVs, human papillomavirus, and the early diagnosis is possible by cervical cytology. So pap smears are routinely performed to diagnose or find out the cervical neoplasias. So in this section now we will talk in detail about what's the pathogenesis of cervical intraepithelial neoplasia and invasive carcinoma of the cervix. We will also talk about what are the risk factors that can lead to cervical neoplasia and what's the life cycle of unstable cervical epithelium. So in this first slide of our lecture, if you see this, this is the detailed description of the cellular changes in the cervical intraepithelial neoplasia. So in this diagram, you see this is the normal stratified squamous epithelium of the ectocervix. Ectocervix is the outer surface of the cervix. Endocervix is the inner part. Ecto is out, endo is in or inner side. So normal stratification, that's the normal structure. It's the normal stratified squamous epithelium of the ectocervix, and this is showing the on the left, it's showing different changes, normal stratification, and then we can see the changes of dysplastic changes that slowly, when it progresses to abnormal growth or dysplastic or atrophic changes, this can lead to the carcinoma of cervical intraepithelial neoplasia, and CIS is carcinoma in situ through the various degree of dysplastic changes. So normal squamous epithelium, and then you see different dysplastic changes slowly. So normal stratified squamous epithelium, and as the cancerous changes or neoplastic changes occur, it leads to dysplastic changes or dysplasia. Now the cells are of different shape with different abundant, and their shape and sizes slowly changes. That's known as the dysplasia or dysplastic changes. Here, these are the infected basal cells. Basal cells are the cells which are present in the base of the epithelium. So here, basal cells, once the infection with HPV or human papillomavirus occur, you see the virus is entering into the layer of epithelium, which now become infected. After the viral replication. So now once the epithelium is infected by HPV, after a few weeks, there is replication of virus inside the epithelium. And then this here you see after weeks, now there is HPV, it goes into the cells, replace the normal cells, and it can now HPV is now present inside the epithelial cell. Now after 10 to 30 years, what's happening? There is now pathogenesis of HPV infection. Now it leads to the actual invasive cancer, and the cells are now getting out of the normal epithelial layer, and it start invading different structures and the tissues. So in this diagram, it gives us a very, very good, clear idea how the changes occur and how it leads to the invasive carcinoma or invasive cervical cancer. Here, first, the normal epithelium. After it is infected with HPV, slowly dysplastic changes occur and cells start appearing like this, dysplastic cells. Then in separate section, it shows once the infection with HPV occur, after weeks, replication of virus takes place and the normal epithelial cells are taken away by the HPV. Now, after some time now, after 10 to 30 years, now this can actually lead to the invasive cancer. Next was the continuum of changes from reserve cell hyperplasia. If there is a presence of reserve cell hyperplasia, how it can lead to the, what changes it can go through to become the carcinoma in situ. So disease is a continuum and reflects the prognostic significance if left untreated. So as we mentioned in the previous slide, that it takes a while, about 10 to 30 years, to actually become the invasive cancer. So if the condition is diagnosed early and it is treated, then we can prevent the progression of the disease to the cancerous stage. So early diagnosis is very, very important because it's the continuation of hyperplasia of the cells. Once the cells keep on growing more and more, it can lead to the cancer. So it's the continuation of reserve cell hyperplasia. In this again, you see this is the normal endocervix. Endocervix is the interior of the cervix, and then this is reserve cell hyperplasia, and this reserve cell hyperplasia slowly can lead to severe hyperplasia. You can see cells start growing and then it becomes the cervical intraepithelial neoplasia and then carcinoma in situ. So early management, early diagnosis is important for the prognosis of the cervical intraepithelial neoplasia, because any cells which are left in reserve, they start growing and then can become carcinoma in situ. Next was the pathogenesis of cervical intraepithelial neoplasia and invasive carcinoma. Usually the process of carcinogenesis or the process of development of cancer start at the transformation zone. Transformation zone is the zone where the columnar epithelium and squamous epithelium, they meet. That's the transformation zone. So squamo-columnar junction of the squamous epithelium and columnar epithelium. So at this squamo-columnar junction, there is replacement of columnar epithelium. Replacement of columnar epithelium in when there is low vaginal pH, it can become immature unstable cells. And this immature unstable cells can then undergo physiological metaplasia, just the normal physiological growth, or they can be lead to changes that can lead to carcinoma. So At the squamocolumnar junction, there is a replacement of columnar epithelium as a result of low vaginal pH. They become immature, unstable cells. And these immature cells can can undergo normal physiological changes that cannot lead to carcinoma, or they can lead to changes that can lead to carcinoma. And then once it can go to carcinogenesis or carcinogen stage, and there is HPV infection. This HPV infection is very common if there are usually if there is a female with multiple sexual partners, and if there is sex at the early age. These are few common risk factors or predisposing factors for cervical intraepithelial neoplasia. Then smoking, if there is persistent infection, if age usually above 30 years, this can lead to atypical metaplasia. And then there is carcinoma, cervical intraepithelial neoplasia or carcinoma in situ, and that can lead to invasive carcinoma. So main thing is at the transformation zone, when there is replacement of columnar epithelium in the presence of low vaginal pH, leads to immature cells. Immature cells now can have two pathways. One is normal physiological metaplasia, and the other one is they can go through changes that can lead to cancer or carcinogenic changes. HPV infection can lead to atypical metaplasia, and then there is cervical intraepithelial neoplasia and carcinoma in situ. So that's how that's the pathogenesis, and what are the steps that lead to cervical intraepithelial neoplasia. Then these are the diagrams that shows the disease progression of cervical intraepithelial neoplasia. Just some simple changes that before puberty. What happens before puberty? The ectocervix. This is the ectocervix or out of the cervical canal. This ectocervix is covered by squamous epithelium. Here. Before puberty, it is covered by squamous epithelium. Then after the puberty, once the estrogen levels start increasing, then the columnar epithelium, the ectocervix is replaced by the columnar epithelium. So squamous epithelium, then columnar epithelium, and now this is the squamocolumnar junction where there is squamous and columnar epithelium is present. Then in this C, there is replacement of columnar epithelium with the columnar epithelium is replaced by the squamous epithelium to cause squamocolumnar junction. Squamocolumnar junction. And then after the menopause, now there is indrawing of squamocolumnar junction and the transitional zone into the cervical canal. Here, cervical canal. So before the puberty, this is the squamous epithelium. With high estrogen level, the exposes the columnar epithelium now into the ectocervix. Now the columnar epithelium into the ectocervix. Then there is replacement of columnar with the squamous, leading to the formation of squamocolumnar junction, and then finally After the menopause, this junction is pulled up into the endocervix or into the cervical canal. Now, risk factors for cervical intraepithelial neoplasia and cervical cancer. The one risk factor, as we mentioned, is HPV. HPV is very common causative factor for the cervical cancer. Also, HIV is a human immunodeficiency virus and chlamydia. Then others, early sexual intercourse. Early sexual intercourse, age around 16 years or less than even 16 years is very common predisposing factor for the cervical cancer. Sexually transmitted diseases can lead to cervical cancer. Early age of first pregnancy, too many and too frequent births, low socioeconomic status, and multiple sexual partners. So all these are very important risk factors, and if the early sexual intercourse as early if it started, it's important to start pap testing to find out the if there is any cell changes in the epithelium so we can diagnose it early and treatment should be started early. Then what's the life cycle of unstable cervical epithelium? Here we divided into three cervical intraepithelial neoplasia, type 1, 2, and 3, or carcinoma in situ. This is the 3 stages. And then we cervical epithelium. If there is regression to normal in 1, it's 60%. In type 2, it's 40%, and 3 is 30%. So regression to normal, if you see, depends on what stage is the cancer is. So in 1, it's very high, about 60% regression to normal of unstable epithelium. Persistence of unstable cervical epithelium is 30% in 1, 35% in 2, and 50% in type 3. There is persistence of unstable cervical epithelium. Progression to 3 is in stage 1, 10% chances that it can progress to cervical intraepithelial neoplasia type 3. And type 2 has 20% chance that it can progress to type 3. Progression to invasion in type 1, it's less than 1%, in 2 it's 5%, and in 3 it's very high, about 20%. Duration of disease progression is usually 5 years in 1 and 2, and then in type 3 it's about 10, and in invasive cancer it's about 20. Age of the patient in type 1 and 2 is 25 to 30. In type 3, it's 30 to 35 years, and in invasive, it's about 40 to 45%. So age of cervical cancer, if you see, it's not old. Usually it starts in age 25. So it's the young age or reproductive age cancer. And again, multiple sex partners, early age, multiple pregnancies, all these are the predisposing factors. So prevention is very important. If the sexual history is of early age, then it's better to use the contraceptive methods to prevent the cervical cancers. So this was the life cycle of unstable cervical epithelium. And type 3, it's more chances that it can persist, or it can progress to invasive cancer. And in the age at which it is present is about 40 to 45 years. So that was all about the cervical intraepithelial neoplasia. Thank you for watching sqadia.com.